my name is Dr. Josiah Nelson. I'm a urologic surgeon who practices in Eau Claire as well as in Black River Falls.
Hi, I'm Kathy Egebakken. I am a physical therapist here at Black River Memorial Hospital. I have been a physical therapist for 25 years.
Hi, I'm Patty Jacobson. I'm a family nurse practitioner at Crone Clinic, and I do a lot of women's health care and do see women with bladder problems. I'm hoping that after this presentation you'll realize that incontinence and leaking is not unusual, that many women have this. Also that there's all kinds of ways this can be prevented. There's all kinds of ways for you to receive help with this problem so you can live a normal, happy life.
I'm Stan Gaynor, the President and CEO of the hospital here, and again, welcome. We're just delighted to see everybody here for a very informative program. So thank you.
And welcome to all of you. I'm glad you're here. As you can see, we have a whole room full, so this is not a problem to be hiding about. Normal bladder function is good to know because sometimes we're not sure if we're normal. So if you go about every 3 to 4 hours, that's pretty common. It should, you should have a strong, steady flow. You should be able to start and stop, and you should not leak in between times. Normal overnight urination, if you sleep through the night without urinating, that lasts until about age 50. After age 50, it's normal to get up once. Between age 50 and 74, once per night. And after that, you might get up twice a night. If you're getting up every 2 to 3 hours, that's not normal, and probably you're not getting very good sleep. So it's a problem you may want to discuss with someone. Twice as many women as men have this problem, about 13 million Americans, and about 50% of older women have problems with incontinence. Urge incontinence, that means you need to urinate. For whatever reason, you just need to go. A lot of times you don't go very much, but you just feel like you have to. Bladder function is kind of complex, and it's stimulated by nerves, and sometimes there's nerves in your bladder that tell your brain you have to go, and sometimes it's your brain saying you have to go. If you ever get nervous and you're in a new situation like I am right now, you have to go to the bathroom, that's your brain. Stress incontinence is when you lose urine when you're exercising, laughing, coughing, sneezing. All those activities put pressure in a downward fashion on your bladder and cause some leakage, and usually that's muscles. The muscles down there aren't quite strong enough to do their job, and in the end gravity wins. Stress incontinence risk factors are listed right there for you. As we get older, we don't use our muscles in the same way. They get a little weak, which is why age can be a factor. Weight gain is pretty obvious. If you have a lot of weight, a lot of women carry their weight in their abdomen, and it's downward pressure on that bladder again. Sports injury and multiple pregnancies. When you have a baby, all those muscles and everything get stretched out of shape, and not very often do they go all the way back to normal.
So I'm going to go on to talking about the exercises that we do here. The program is actually called Beyond Kegel's Roll for Control. The roll for control is actually using two muscles, rolling in and rolling out, using your obturator internus to elevate the bladder floor. And if you think about your bladder as being a hammock that's in that pelvic floor, and that there's two trees on either side holding that hammock up, basically that's what our legs are doing for our pelvic floor. And when we roll our legs out, we're pulling those trees apart and we're pulling that pelvic floor up. And when we do that, that closes those sphincters, and that's what helps it stay closed. When we're talking about walking being the #1 benefit for exercise, for incontinence, is it because it works those hips internal rotators, it keeps your pelvic floor in a good position. It also works your diaphragm, which is the top end of that whole central core in there. The whole technique I do is non-invasive. I'm not even going to ask you to undress during it. I'm not going to do any invasive testing at all. It's a very simple program. It's very holistic. I look at your whole body and your whole lifestyle and what you're doing. In order to see physical therapy, remember that you would have to see your doctor first and get an order for it. Thank you.
So tonight I'd like to discuss first some of the anatomy that goes into the what we're talking about. I'd like to talk then about treatments for urge incontinence, treatments for stress incontinence, And finally, we'll talk a little bit about what may be coming along in the future. The first thing I'd like to talk about is the bladder. The bladder, as you can see, is circled in that picture. The bladder's job is to store urine at low pressure until it's socially appropriate to get rid of it. The urinary sphincter and the supporting tissue that Kathy was discussing is there and is circled. And that's the job there is to hold the urine back, again, until things are socially appropriate. Finally, we have the urethra, which is the tube that the urine exits from. When we're talking about incontinence treatments, we often need to do some testing. And prior to beginning treatments, we talk to you, we do a history. There's a physical exam where we look to see if there's any problems with the pelvic organs that may be causing problems or leading to the incontinence. And finally, we may do more diagnostic testing, sort of a fancy bladder testing where we fill up your bladder, check to see how your bladder, the pressures that your bladder fills, and go from there. That's called urodynamics. In terms of urge incontinence, there's treatments with medications called anticholinergics. There's treatments with estrogen. There's treatments with antidepressants that actually have some side effects that work well for urinary incontinence. You can treat with botulism toxin or Botox. We can get rid of the wrinkles in the bladder that way. So, and we also have a bladder pacemaker that can be implanted and help for urgency. All these medications block some of the chemical messengers that help trigger abnormal bladder contractions, and they help try and relax the bladder a little bit, giving you more time to make it to the bathroom and also to hold the urination when the urge hits. Estrogen is something, as we age, females often lose some of the estrogen that's in the body. And estrogen helps maintain strength and flexibility of some of the tissues. After menopause, less estrogen equals more weaker tissues. So what we can do is sometimes treat with low doses of creams, rings, or patches in the vagina, and allow those tissues to become healthier and stronger. Botulism toxin is a newer and sort of exciting way to treat the bladder and the urgency. What it does is it paralyzes some of the muscle in the bladder, which helps relax the bladder and give you relaxations from the urgency. Research and human trials have shown significant effects for this. Unfortunately, it isn't FDA approved yet, and oftentimes it requires some work on the insurance companies to treat for it, but it works quite well, especially if there's a neurologic condition as the cause of the urgency and incontinence. And finally, for urinary urgency, we have a bladder pacemaker. This is a device that can be triggered externally before implanting that gives a delivery a little electrical signal to some of the nerves that go to the bladder. It's done as an outpatient surgery where patients are able to go home. It requires some testing prior to inserting the device. But when it's effective, it works for many years. It doesn't require any additional medications or any additional treatments. For stress incontinence, we have three different main options, three different subheadings. We have bulking agents, we have sling procedures, and then there's some bladder surgery. Bulking agents are agents that can be injected into the sphincter itself. These help bulk up the sphincter and give it more room to help block the urine. Things like collagen, carbon-coated zirconium beads, or coaptite are used. You can have sling procedures, and here in this picture we see a little sling creating a hammock around the urethra. These can be made of your own body's tissue, they can be synthetic materials, or they can be made of mesh. They provide support to help keep that urethra closed when there's coughing, sneezing, and there's low risk of complications associated with these treatments and high rates of success. So I just wanted to thank everybody for coming here tonight. I wanted to thank Stan and Jay and Mike and Craig for helping put this program on, and I would ask that if you have any questions, we can get started.